This week's video will tell you everything you need to know about Invisalign. I'm here with my friend and dentist, Dr Ehsan, to answer all those important questions you may have at the start, during and after treatment. So when I first started my Invisalign treatment, I think you remember, I was really worried that I was going to break my tray, it was going to tear when I was pulling it out because it was so tight and it was so difficult getting used to pulling it out. And I think a lot of people are going to be worried about that too. So what would be your first bit of advice for that?
The trick to it is to be as gentle as you can. So you shouldn't forget it's a piece of plastic. So if you pull too hard, it's going to snap, it's going to break. So you want to be loosening it up from the back gently and then slowly following it all the way around for it to come out. But you don't be pulling one specific area really hard because it'll rip that specific area. Yeah,
which is the mistake that I made right at the start on the first tray. And I think another tip is where the actual attachments are called, where the attachments are, kind of lift it over as you work your way around. Lift it over the attachment and that really helps. So bad news, you've now either lost a tray or you've broke a tray. What do you do at this point?
It can happen, but it's really important for you to keep the trays that you've already worn. Say for example, it's tray number 5 that you've broken. If it's the first few days that you're on tray number 5, go back to tray number 4 and continue wearing tray number 4 until you've seen your Invisalign provider to get replacement for number 5. If it's the last few days of you being on tray number 5, then you can move on to tray number 6 in the interim of seeing your Invisalign provider.
Okay, so I think speak to your Invisalign provider, and also it's really important that you keep your old tray. Now if you remember, when we first started my Invisalign treatment, my bite was in such a way that I was kind of biting on my attachments, if that makes sense. But now it's all fine, now I'm not biting on my attachments. And I was really worried about that as well, because I was worried, oh, what if I'm chewing on something and I knock into it and it snaps off. So firstly, how often do they actually break? How strong are they? And what should you do if it does break?
They're bonded to the tooth and they're very strong. So you rarely find that the attachments break. But if they do, all you have to do is go back to your Invisalign provider, have the attachment replaced. But make sure you continue wearing your trays in the interim before the attachments are replaced.
Okay, and is there a way that you can check them? Should you be checking them at all?
When you're placing the trays into your mouth, you need to make sure that they cover the attachments. So the areas that are bulged out on the trays, which are meant to cover the attachments, you've got to make sure that they're covering them well. And if you find that over a few trays they're not covering the attachments, then discuss that with the provider.
Now sometimes you don't have your chewy with you or you don't have a cotton roll with you. Is it okay to bite the trays together, like my trays right now, biting them really hard so you can get in really deeply? Is that okay to do?
The chewies make sure, or the cotton rolls, make sure that the trays are seated all the way. So if you don't have your chewies with you or the cotton rolls with you, it's best to just press with your thumb against the trays, just to make sure they're seated all the way. Just putting them in and just biting isn't going to be sufficient, so you need to make sure that they're squeezed all the way in.
In terms of oral hygiene, should you brush your teeth straight after eating food, or should you wait a little and then put your trays in?
It's best to wait 15-20 minutes before you do brush your teeth. Just to allow the surface of your teeth to remineralize and not damage the surface of your teeth by brushing straight after food.
One thing that I noticed whilst I've had my Invisalign trays, you will probably stop snacking because it takes a lot of effort having to take your tray out, brush your teeth and then put them back in. And also it's probably going to affect your treatment as well because you're not meant to keep them out for too long.
Yeah, so you're going to be keeping them in minimum 22 hours a day. So if you add that up, you've only got a 2-hour window. So snacking, it'll be very difficult.
Snacking is basically out of the question. In terms of liquids, because I know you can drink clear liquids like water, but there's many clear liquids. For instance, lemonade is clear, and you can get alcoholic spirits that are clear. Is that okay? Is it because I imagine it's because it's going to stay in your trays, or is there another reason why you can't do it? And also smoking, can you smoke with the trays in?
So it's not the colour of the liquid, it's what the liquid can do. Right. So the liquid can sit inside the trays if you consume it whilst you have the trays in, and it can bathe your teeth in that liquid. So it can either stain or it can damage the surface of your teeth. So it's best to avoid anything other than water with the trays in. And also smoking, you should be smoking anyway.
That's true, smoking is bad, causes many different health conditions.
All kinds of things.
So don't smoke.
Yeah.
It's not cool to smoke.
Yeah, just quit it.
Quit it. One question that came to mind after a few months of having the trays in is mouthwash. Obviously sometimes your mouth's getting a bit dry, it might start to smell a little, and you think to yourself, you know, if I put mouthwash in, rinse it around with the trays in, is it okay whilst the trays are in, or will you have to take them out?
The issue with that is some mouthwashes tend to stain teeth, but the easiest thing to do is take the trays out, give them a good clean, then use the mouthwash, whichever mouthwash it is that you've been advised to use, and then put the trays back in.
Now, in terms of cleaning the trays, how often should you be cleaning them? Should you do it every time you take it out, or can you do it once every now and then?
It only takes a few seconds. As soon as you've taken them out, give them a little scrub and just put them aside. And as soon as you put them back in, another rinse, and that just stops all the saliva becoming hard on the trays and all the plaque accumulating on the trays.
I remember when I first got them in, you said to use soap and water.
Yes.
Should you do that?
So yeah, soap and water once every night, just before bed, give it a good scrub and it keeps it nice and clean.
So that's like deep clean.
Pretty
and
much.
then you do the easy clean, just a
Yeah,
quick
just
brush.
with a quick brush, yeah.
So when I first started the trays, I was experiencing dry lips. I think it's probably because I wasn't used to having the trays in my mouth and I was licking my lips. Is it okay to use a lip balm whilst you've got the trays, it's not going to damage the trays?
Perfectly fine. Anything that you usually use to soften your lips, you can use, not an issue.
Perfect. So when you put a new tray in, you do experience a little bit of soreness. Obviously everyone's different, so what will the viewers need to know, like what are they going to experience?
The most amount of soreness you experience is the first couple of minutes of putting the new tray.
Okay.
After which it starts becoming a dull soreness, and it will last maybe a few days after placing the new trays in. But it's genuinely nothing to worry about. What's your experience been?
My experience has been pretty fine. I haven't ever experienced pain, just soreness. One thing that I do is I sort of put it in towards the evening. Then I know I'm not going to be taking it out. I've had my dinner, I know I'm not going to be taking it out, and I'll sleep with it on, and then the soreness goes away after a good night rest. But I mean, if you do need painkillers or any analgesics, then you can always speak to your pharmacist and they can recommend you something.
Or the dentist.
Or the dentist. I mean, are we gonna go there?
I thought you were been there.
Are we gonna go there? So during my treatment, I have felt that some of my teeth have become a little wobbly, especially when I've changed tray. Is this normal?
It is normal. Don't forget the teeth are moving into new positions. So naturally they are going to be slightly wobbly to be moving into the new positions. So it's a very small amount of movement and it's nothing to worry about, and it will settle after treatment is complete.
But if it's wobbling, so the wobble should be very minute, it's nothing major.
It shouldn't be noticeable, it should be the smallest amount of movement.
If it is noticeable,
then you should really be having Invisalign treatment.
You shouldn't really have it. You should speak to your dentist.
Yes, definitely speak to your provider, speak to the dentist to make sure everything's okay.
So you've now finished your treatment, your teeth are looking fantastic, you're happy with the results. What should you expect after treatment is completed?
It depends on the case. Some patients will require a fixed wire that's placed on the inside surface of the teeth. It is invisible, but it's just to make sure that the teeth are kept in their new positions. But everyone is going to be needing a removable Essex retainer, which you have to wear at night time.
So I guess the moral of the story is you're going to have to get used to wearing a tray. So during your treatment, how often are you expected, can viewers expect to see their dentist? And during these visits, what can they expect?
It's generally after every 4 or 5 trays, just to make sure everything's moving into the places that they should be.
Yeah.
Make sure that the spaces between the teeth are present as to what they should be. And if there's any adjustments that need to be made, either in between the teeth or with the trays, then we do it in the appointments.
So I guess it's nothing scary then? There's nothing,
no, definitely not.
They're not going to pull a tooth out?
No. It's mostly like a review appointment.
Okay, yes. Just making sure it's all moving correctly.
There are some adjustments that need to be made usually, but it's just to make sure everything's on track.
So once your treatment is complete, can you expect the teeth to all be the same height as well? So obviously they're going to be a lot straighter, but will the height of the teeth all be the same, like the classic Hollywood smile type look?
Before you start the treatment, the Invisalign treatment, you go over a treatment plan and a clean check is carried out, which is a computer simulation of what the expected outcome would be. So that is the outcome that you'll be aiming towards, and it's that stage. If you want all your teeth to be nice and straight and level, that's what should be discussed with your dentist at that point, to explain to them exactly what you're trying to achieve.
And what options do you have? Sorry to interrupt.
If it's achievable, if everything can be leveled out, and if it's achievable, then that's perfectly fine and it will be achieved. If it isn't achievable with the Invisalign, then there are other restorative options available, such as composites and veneers and things like that.
So you've now finished your treatment, but unfortunately your teeth aren't looking the way you expected it to look, or they're not looking the way that it showed on the simulation thing. So what can you do at this point?
That can sometimes happen. The teeth sometimes don't track as we expect them to. And it's simple. We just take new impressions, send it to the Invisalign, and new aligners are sent, and it's sorted.
So it can be fixed?
It is fixable, yes.
So you can't see your dentist for it?
No.
And that's my last question, Dr. Ehsan. Thank you very much for taking the time out on this bank holiday Monday for us to film this. I think a lot of people are going to find this video very helpful. When I first started my treatment, I did search for a video like this on YouTube, but didn't come across anything like it, that you were speaking to an actual dentist and getting their advice. So I think a lot of people are going to find this video helpful. Also, if you guys have any questions or anything like that, leave a comment below and we may make a part 2. We may make a part 2, is that okay with you?
Yes. Yeah, no problem at all.
Perfect.
Down below.
Oh yeah, sorry. Also, please follow Dr. Ehsan. Send some love to him for taking the time out to help with this video on his Instagram. Give him a follow. I will leave a link here, well, I'll leave the Instagram ID here and a link in the description below. See you next week.
An Essex fixed retainer. It's not a fixed Essex retainer, it's very good. It's a removable retainer.
Amateur. Someone said the S6. I know the S6 retainer. But you're not happy with how it looks. What would you do at this point? Don't look at me like that.
Why you got to be unhappy? You told me you were happy with your treatment.
No, I'm happy, but if somebody is not happy with their treatment,
they have to be happy as well.
That's true. But I guess if you're not happy, you can just sue your dentist.
No, please don't.
She's so angry.
I can agree with that.
If only you guys knew how angry she is. Even right now, she's going red. Nadia.
You guys need to just get back to filming. You need to stop having a laugh.
Let's get back to filming. Sorry, Nat.
It's literally the first few minutes where you experience the
That's it now, it's become a battle now. We're gonna anytime we mess up, we're gonna Hey guys, thanks for watching this week's video. Make sure to click that like, follow or subscribe button now to stay up to date with new weekly videos.